So today we're going to discuss if necessarily kidney disease ends in kidney failure, and as a consequence, the need for dialysis or a kidney transplant or not. For those who tune for the first time, I'm Dr. Francisco. I'm a specialist nephrologist, a transplant immunologist, and a health promoter. This is the bite-sized information for kidney and related conditions. The aim of this video blog is to give better information to patients or the relatives to be better informed so they can discuss in a better way with their own doctors or with me if they choose me, so they can manage the disease better with less worries and less complications. So I hope you find this video useful and the previous one and coming ones as well. So does necessarily kidney disease ends in kidney failure and the need for dialysis or the need for a kidney transplant? The truth is that not all patients with chronic kidney disease eventually develop total kidney failure. In other words, not all patients with kidney disease need to undergo dialysis or a kidney transplant. There are many factors responsible for this. First of all, there is no single cause of kidney disease, and every disease behaves differently, some more aggressively than others. So the progression and risk is different in every single patient. Plus the fact that every patient is per se different, and also in general, not regarding the kidneys, but the whole body, etc., the whole health is different, is great part of why some patients can go into failure or not. Second, the current status of your kidney or the current status of your disease, kidney disease, or the status of your kidney disease when it was discovered also determine your chances to progress to total kidney failure. For example, if the disease is detected early, therefore amenable to intervention, that is modification of habits or the use of medications to protect the kidneys, then the chances of disease progression tend to be lower. But on the contrary, if detected late or once the disease was discovered, the percentage of kidney function left is already quite low, you will have higher chances of developing kidney failure as the time passes by. It is very important because this illustrates the importance of early detection and screening, especially if you or your relative or your loved one or your friend has personal or family risk factors for kidney disease, like type 2 diabetes or any type of diabetes, high blood pressure, inheritable diseases like polycystic kidney disease, or some autoimmune disorders in the family, among many others. Third, not every patient, and this is very important, not every patient takes the same good care of their health or their kidneys. Not every patient adheres equally to their treatment for his or her underlying medical condition or kidney problem. And also, not every patient modifies accordingly his or her diet and lifestyle according to their health or kidney disease. And as a consequence, and also greatly based in my professional experience, patients with chronic metabolic conditions and kidney disease, if they take good care of the kidney disease or their metabolic conditions, they tend to live a longer and fuller life. Also, if they try to live a more frugal life and a more active lifestyle, so means that don't go on excesses with diet, try to attach as best as I can with the diet restrictions, try to do some exercise, keep the mind active, try to still, continue working even part-time rather than just being, at home all the time. Plus attending appointments, that it means if they attend all the appointments, they can get advice opportunely, meaning that we can give you strategies that you can apply on time to try to protect their kidneys better. So if they follow medical advice and do all that, they also tend to live longer and better, and also will have less risk for disease progression and chances to develop total kidney failure. And the opposite is unfortunately totally true. For those not taking good care of themselves, diet, lifestyle, medications, following medical advice, etc., they tend to progress faster to kidney failure, or they have more chances to develop kidney failure. At the end of the day, it's not just kidney failure the problem. The problems start adding as the kidney function start going down or the disease is progressing. So it's not just avoid kidney failure. Many patients maybe don't develop kidney failure, but still they can add extra problems as the disease progresses. And many patients even don't develop kidney failure. They can have a heart attack and unfortunately perish before that. So that's why it's important to try to detect any kidney problem if you have risk factors or runs in your family. And once you discover, to try to treat it as best as you can with medications, diet, lifestyle, and all together. Indeed, there are many other important factors that determine the chances to develop kidney failure or total kidney failure, besides the ones I mentioned, and they vary patient to patient. So, but knowing that it is very important to take care of your health, and all your health and well-being it is at stake. So I recommend you to address all your concerns with a specialist kidney doctor and be evaluated by a specialist kidney doctor. If you have one, you can do it with them. You can also consider me, because we can individualize our opinion, our advice to your particular case. Every patient situation is different. So our advice follows the same general rules, but we tailor it for every specific patient. The disease doesn't behave also the same in every patient. The risk is not the same. I know it is not easy living with kidney problems, especially with the worry of disease progression and all what that implies, worried about your health, your life, and even worse if you already develop advanced kidney disease or total kidney failure. So aiming to prevent or retard kidney disease progression or complications is very important. And getting help for specialists, doctors like me or whoever you want to be your doctor, it is very important, because it can help you fully understand this process and how to manage your disease better. But also, being frank, many patients, despite they do the best to take good care of themselves, sometimes the disease is too aggressive, and despite all their efforts, the kidneys still give up and go into failure. That has happened to many of my patients, and then I advise them to prepare or go for dialysis or a kidney transplant. Before concluding, I want to mention that there are also cases of temporary kidney failure, what we doctors call acute kidney failure, where the patient can need dialysis for a variable period of time, and later start showing recovery, and then the dialysis can be stopped. However, these patients still need to continue on follow-up as they have a higher risk of developing progressive kidney disease than people without this problem. So just bear that in mind if unfortunately you or your friend, your relative had an episode of kidney failure. In Francisco Kidney and Medical Center, we walk this path hand in hand with our patients, and we provide empathetic, approachable, and flexible specialist renal medical care, because we can imagine the struggles our patients could experience or face, and we care about the physical and mental well-being of them and their families, because not only the person who suffers the disease is suffering, actually, is all the people around them, because it's not nice to have a relative or a loved one with this disease. So we understand that, and we try to make all the whole family understand the importance. And also I even extend my advice in good faith to the relatives. If I see if they're smoking or if they have a little bit of weight or diabetes, I encourage them to do the best so that they cannot run into this path, because you don't want 2 or 3 members of the family ill as well. So I really focus not only in the kidneys of my patients, in the whole well-being, what we call holistic, but also in the whole well-being of their entire family, and not only the physical, but also the mental, and sometimes, you know, the social or professional or economical, financial well-being. I give sometimes some extra advice to my patients, and they welcome that. So I wonder if there's any question. If you need my help, you know how to contact me. I just wait a few seconds for any comment, question. If not, you can put in the replay. Otherwise, thank you for your attention. I am Dr. Francisco, wishing you the best possible health. Take care. Bye-bye.